Welcome to today's presentation, and we will dive into a captivating and rapidly evolving field of medical science, with the potential to revolutionize the treatment of various diseases. Our focus is on the gut microbiota and its profound impact on human health. It is firmly established that an imbalance in the quantity and quality of gut bacteria can have profound consequences for our well-being. Over the past decade, scientific research has shed light on the pivotal role played by our gut microbiota in influencing a wide range of diseases, including gastrointestinal disorders, chronic inflammatory conditions, and even the effectiveness of cancer immunotherapy and chemotherapy. Today, we will explore a groundbreaking strategy that has emerged to address this microbial imbalance: fecal microbiota transplantation, or FMT. FMT represents a promising avenue in the quest to restore the delicate microbial equilibrium within our bodies. At its core, FMT aims to re-establish this balance by introducing healthy commensal bacteria into the colon, effectively replenishing the recipient's microbiota. This procedure involves the collection of fecal matter from rigorously tested and healthy donors. The collected fecal material is then meticulously processed, mixed with normal saline, and administered to the patient using various methods, such as colonoscopy, endoscopy, nasogastric tube, or enema. While FMT initially gained recognition as a remarkably effective treatment for recurrent C. diff infections, its potential extends far beyond this singular application. Emerging research suggests that FMT may hold the key to addressing a spectrum of diseases associated with gut microbiota dysbiosis. This includes conditions like resistance to immunotherapy or chemotherapy in cancer, opening up new horizons for cancer treatment and patient care. In the upcoming minutes, we will look deeper into the topic of stool donation, specifically how to select healthy donors for stool collection. Thank you for joining us for this enlightening discussion. Let's begin with the donor screening process, a crucial step in minimizing and averting adverse events during fecal material infusion. The journey commences with a meticulous donor selection procedure. First, candidates participate in a pre-screen survey, resulting in the exclusion of approximately 65% of them. Common reasons for exclusion include abnormal body mass indexes, logistical constraints, or recent antibiotic usage. Following this initial screening, each potential donor undergoes an interview to identify any risk factors associated with transmissible diseases. This involves a comprehensive clinical assessment, meticulously conducted to ensure the safety and effectiveness of these medical procedures. Understanding the factors that contribute to adverse health outcomes is crucial when considering potential fecal donors. Various conditions, such as a personal history of chronic gastrointestinal diseases like inflammatory bowel disease or celiac disease, as well as systemic autoimmune disorders or a history of cancer, especially gastrointestinal cancers, play a significant role. Recent abnormal gastrointestinal symptoms and a history of neurological or psychiatric conditions are also factors to consider. Obesity and metabolic syndrome or diabetes can further complicate the picture. Additionally, a family history of premature colon cancer or early-onset polyposis syndromes raises important concerns. It's essential to thoroughly evaluate potential donors to rule out these conditions, as they can, in part, be attributed to undesirable functional alterations in the gut microbiome, which could affect the efficacy of fecal microbiota transplantation. When considering a potential fecal donor, it's important to ensure that they are not currently taking any medications that could impact the gut microbiota. This includes avoiding drugs that can alter the delicate balance of microorganisms in the gut. Furthermore, recent exposure to systemic antimicrobial drugs, immunosuppressant agents, or chemotherapy within the last 3 months should be carefully evaluated. Additionally, chronic treatment with daily use of proton pump inhibitors for 3 months or more should be taken into account, as these factors can significantly affect the suitability of a donor for fecal microbiota transplantation. In order to ensure the safety of fecal microbiota transplantation recipients, suitable donors should undergo both blood and stool testing within 4 weeks of donation. The primary purpose of this donor testing is to detect the presence of infectious diseases that could potentially be transmitted to the recipient. Blood testing includes screening for hepatitis A, hepatitis B, hepatitis C, hepatitis E, HIV, syphilis, treponema, nematodes like strongyloides, as well as routine blood tests, such as a complete blood cell count and a comprehensive metabolic panel. These selected blood exams contribute to an excellent safety profile. While some tests should be mandatory, additional and optional tests may be recommended, based on geographical areas, clinical conditions of recipients, or the medical history of donors. These precautions, including expanded screening tests, are taken to ensure the maximum safety for patients, even when there is limited knowledge about the transmission of certain potential pathogens through fecal microbiota transplantation, like human T lymphotropic virus. Once suitable donors have been identified and selected by the clinician, the next step is to collect stool samples. This process takes place over a 28-day period, following consultation with the prescribing physician. The stool samples are subjected to a comprehensive set of tests to ensure their safety and suitability for fecal microbiota transplantation. These tests include screening for various pathogens such as Clostridioides difficile, common enteric pathogens like Salmonella. Additionally, they assess antibiotic-resistant bacteria, including vancomycin-resistant enterococci. The screening also covers viruses such as norovirus, and parasites including Giardia, Microsporidia, Protozoa, helminths, and other potential pathogens like Blastocystis. For upper routes of fecal matter delivery, Helicobacter pylori fecal antigen testing is also included in the evaluation process. These thorough tests are essential to ensure the safety and efficacy of the fecal microbiota transplantation procedure. Lastly, but of utmost importance, we as physicians must ensure that we address specific issues on the same day as the donor's stool donation. This step involves checking for any recent onset harmful events or changes in the donor's health status. We carefully look for new gastrointestinal signs and symptoms like diarrhea, nausea, vomiting, abdominal pain, or jaundice. Additionally, we investigate new infection signs and symptoms, such as fever or swollen lymph nodes. We also inquire about the use of antimicrobial agents or other drugs that might have affected the donor's gut microbiota since the last screening. We gather information regarding any unprotected sexual encounters with new partners and any high-risk or tropical travel experiences, as well as direct contact with human blood, all since the last screening. These meticulous assessments are crucial to ensuring the safety and suitability of the donor's stool for fecal microbiota transplantation. Anyone who meets the specified criteria can become a stool donor. Fecal microbiota transplantation (FMT) can come from donors who are either related or unrelated to the recipient. In certain cases, the choice of donor may be guided by specific requirements. According to existing research, there isn't a significant distinction in FMT outcomes between relatives and unrelated donors, patient-selected donors, or anonymous healthy donors. Additionally, there's an alternative known as autologous fecal microbiota transplantation, (auto-FMT). This procedure is well received and effectively restores beneficial bacterial populations, all while sidestepping the potential introduction of unfamiliar viral or microbial agents to the patient's system. So, anyone fitting the criteria can be a donor, whether related or unrelated, and different donor choices don't seem to significantly impact FMT results. When it comes to collecting stool samples for donation, timing and proper handling are essential. The screening process must be completed within a month before the collection. It's important to note that screening needs to occur both before and after the donation period to ensure the safety of all stool samples collected and frozen during this time frame. Donors are provided with clean, opaque plastic bags that can be easily opened over a toilet to collect the stool and then securely sealed before placing them in a larger storage bag. Donors have the flexibility to either donate on site or take the bag home with a cooler box and ice pack to ensure delivery within 1 hour of defecation. Stool samples can be safely stored for up to 8 hours at 4 degrees Celsius without a significant impact on bacterial survival. However, it's crucial to understand that viability declines if stored at room temperature or at 4 degrees Celsius for more than 8 hours. Thank you all for your attention and for being such an engaged audience. If you have any questions, or if you're considering donating stool samples for our important research, please don't hesitate to reach out to us at Omega Precision Oncology Clinic. We're more than happy to assist you with any queries or guidance you might need. Your contribution could be invaluable in advancing our understanding and treatment of various conditions. Again, thank you for your time, and we look forward to hearing from any potential donors or anyone with questions.